Let me tell you about something I see all the time in my older patients. They do almost everything right. They take their medications, they walk in the morning, they've reduced salt, they're trying to eat better. And yet, every time we check their blood pressure, especially in the morning, it's still higher than it should be. They look at me frustrated and say, "Doctor, what am I doing wrong?" And often, the answer isn't something they're doing during the day. It's something happening every single night. There's one very common night habit that quietly keeps blood pressure elevated, and most seniors have no idea it's affecting them. It doesn't feel dangerous. It doesn't feel dramatic. But it steadily pushes the nervous system into overdrive and prevents blood pressure from dipping the way it's supposed to while you sleep. That habit is poor quality sleep, especially staying up late under bright light, watching television or scrolling on a phone or tablet, and then sleeping lightly or waking multiple times through the night. Now, let me explain why this matters so much. Your body is designed to lower blood pressure at night. This is called nocturnal dipping. In a healthy system, when you fall asleep, your nervous system shifts. Stress hormones drop. Your heart rate slows. Blood vessels relax. Blood pressure naturally falls by about 10–20%. That nightly dip gives your heart and arteries time to rest and recover. But when you stay up late under artificial light, especially blue light from screens, your brain delays melatonin production. Melatonin isn't just a sleep hormone. It's also involved in regulating blood vessel tone and calming the nervous system. If melatonin release is suppressed, your body doesn't fully switch into nighttime repair mode. Instead, stress hormones like cortisol and adrenaline remain slightly elevated. Even if you fall asleep, your system doesn't fully power down. Your blood pressure doesn't dip the way it should. And over time, that missing nightly recovery keeps your average blood pressure higher. I've had seniors wear 24-hour blood pressure monitors, and what we often see is this. Their numbers look decent in the clinic, but at night, instead of dipping, their blood pressure stays flat or even rises. We call this non-dipping hypertension, and it significantly increases the risk of stroke, heart attack, and kidney strain. And here's what's fascinating. Many of these individuals don't feel stressed. They'll say, "I'm retired, my life is calm." But the body doesn't just respond to emotional stress. It responds to light exposure, screen stimulation, late-night news, suspenseful shows, social media scrolling, and even eating too close to bedtime. Let's talk about another piece of this night habit, late-night eating. When you eat within 2 hours of bedtime, especially carbohydrates or salty snacks, your body has to digest. Digestion activates the sympathetic nervous system, the fight or flight side. Blood sugar rises, insulin rises. If insulin stays elevated, the kidneys retain more sodium. Sodium retention increases fluid volume. More fluid means higher pressure inside the arteries. So instead of your body resting, it's working. Instead of pressure dropping, it stays elevated. And then there's sleep fragmentation. Many seniors wake up multiple times during the night, sometimes to urinate, sometimes due to mild sleep apnea, sometimes just because sleep becomes lighter with age. Every time you wake up briefly, your brain activates, your heart rate rises, blood pressure spikes temporarily. If this happens repeatedly, night after night, those spikes add up. Sleep apnea deserves special mention. Even mild, undiagnosed sleep apnea can significantly elevate nighttime blood pressure. When breathing pauses, oxygen levels drop. The brain senses danger and releases adrenaline to wake you up enough to breathe again. That adrenaline surge constricts blood vessels and raises blood pressure sharply. Some people experience this dozens of times per hour without realizing it. Now imagine this happening for years. The arteries stiffen. The heart works harder. Morning blood pressure readings creep upward, and people assume it's just aging, but often it's the night habit. Let's also talk about something quieter but powerful. Mental stimulation before bed. Watching intense news cycles, crime dramas, heated debates, or even scrolling through emotionally charged content keeps the brain alert. You may feel physically tired, but mentally you're still activated. That mental activation keeps the sympathetic nervous system engaged, and that system directly influences blood vessel constriction. Your blood vessels are lined with smooth muscle. When the nervous system is calm, those muscles relax. When it's stimulated, they tighten. tight vessels mean higher pressure. There's also the issue of bedroom environment. A warm room can prevent deep sleep and impair that nighttime blood pressure dip. Light leaking through curtains can reduce melatonin. Even small LED lights and electronics can affect sensitive sleepers. Noise disturbances cause micro-awakenings that elevate heart rate and pressure. And then there's alcohol, another common night habit. Many seniors use a small drink to relax. While alcohol may make you sleepy initially, it fragments sleep later in the night and increases sympathetic activity in the second half of sleep. It also interferes with the natural nighttime drop in blood pressure. Now here's the good news. This is one of the most correctable contributors to high blood pressure. When seniors improve nighttime habits, I often see measurable changes within weeks. Here's what makes the biggest difference. First, dim lights at least 1 hour before bed. Reduce screen exposure. If you must use a device, lower brightness and consider blue light filters. Second, set a consistent sleep schedule. The body thrives on rhythm. Going to bed and waking at the same time strengthens circadian patterns, improving melatonin release and vascular relaxation. Third, stop eating at least 3 hours before bedtime. Allow insulin to fall. Let the digestive system rest. Fourth, evaluate for sleep apnea if there is snoring, gasping, morning headaches, or excessive daytime sleepiness. Treating sleep apnea can dramatically lower nighttime blood pressure. Fifth, create a true sleep environment, cool, dark, and quiet. And finally, build a calming pre-sleep ritual. Gentle stretching, deep breathing, reading something relaxing, prayer, or meditation. These shift the nervous system toward parasympathetic dominance, the rest and repair mode that allows blood vessels to soften and pressure to drop. I've seen seniors reduce systolic blood pressure by 10 to 15 points simply by restoring proper nighttime dipping. Think about that. Not another pill, not another dosage increase, just allowing the body to do what it was designed to do at night. Blood pressure is not just about salt. It's not just about age. It's not just about medication. It's about rhythm. And when nighttime rhythm is disrupted, even in subtle ways, blood pressure pays the price. So, if you're a senior struggling with stubborn readings, ask yourself honestly, what happens in the last 2 hours before bed? Are you feeding your nervous system stimulation? Are you exposing your brain to bright light? Are you eating late? Are you sleeping lightly or waking frequently? Because sometimes the most powerful intervention isn't something you add, it's something you stop doing. And once the body finally gets a full, deep, restorative night of sleep, the heart relaxes, the vessels soften, and the numbers begin to follow.